Hello, Andrew, and welcome to this week's podcast. Thank you very much for joining us today.
Thanks for having me, Donna. Great to be here and see you again.
I know we met. I was looking back; it was 4 years ago when I came out to your practice, which was a bit smaller out in Canning Vale in WA, and crazy, isn't it? And talking about sleep back then, and yeah, I just loved your energy around parenting and mums. When I met you, we obviously talked about sleep, but I just loved all the passion that you had for parents and young mums and families and dads, so, and look where you are now. You've got a bigger practice in a suburb called Murdoch. Is that correct?
Yes, so I've started the Garden Family Medical Clinic in Murdoch, and it's since expanded to Piara Waters as well. So has been busy, but the thing you said about parenting, like nothing beats actually being a parent in terms of the education I've received from my own kids and how they
Yes.
teach me and what I can take into my own clinic day to day. A lot of that comes from being a parent myself through the ups and downs. Yeah.
Lived experience, isn't it? And that's what it's about with my platform of sleep and now going into the conscious parenting realm. It's all about parenting, and a lot of it is lived experience. We can read lots of books and research, which I love, but it's the lived experience, isn't it?
That's right. It's definitely the lived experience, and you get a lot more empathy for what parents have to go through that way.
Yeah, because your kiddos are, you said 8 and 10. I think I just
Mm-hmm.
asked that,
Yeah, primary school. Yeah.
I know, and it's such a beautiful age. And what I would like to talk to you about today, because I should have announced you as Dr. Andrew Leech, because you are a doctor.
That's okay.
I
That's
just was
okay.
casual
Just
there.
just Andrew is fine. Yeah,
Just
keep it
Andrew.
casual.
You're
Yeah.
not just Andrew, no. So you were in one of our biggest papers over here, newspapers the other weekend, talking about teen mental health and anxiety and stuff like that. So I thought I'd love to get all of, what you're feeling like, what's happening, and what people can do, because people feel very, I think, lost. Because what I'm finding working with children, families one-on-one, and, my demographic's sort of up to 7. But what I'm finding, particularly in the last 4 years, anxiety is so much higher in our children. And, I've done a lot of study on, giving parents tools for that. But it seems to be quite on the rise. Are you feeling that as well?
I would say anxiety is the number one presenting condition related to mental health in children and adolescents and probably adults.
Yeah.
It's really taken over since COVID, I think, but I don't know what exactly COVID did to cause such a spike, because we're sort of moving on now from that. Maybe the awareness has gone up and people feel more comfortable coming in. And that's sort of having an effect on people getting help earlier, which is good. But I think there's also a lot of pressure in families' lives that is leading to challenges with their mental health. And there's various things that I see day to day here through what families experience that makes anxiety become more of a problem and very challenging. And I'm happy to go through some of those things because it's so hard. And one thing overall is that we're all sort of living in a much faster paced world than what we were maybe a generation ago. And our parents and their parents probably didn't quite have so many activities and stimulation from screens and things going on in their day. It was a lot more structured, ordered, and routine, maybe as a generalization, but
not at all. No. And the thing is with that too, is my kids are 19, crazy, 9, every time I say I'm like, I can't be that old, 19, 16 and 13. And even that even is a generation, but a mum to those smaller children, that's why I'm so passionate in the last 5 or 6 years, because you're exactly right. It's under stress. There's too much information. Parents might feel they're on the right track, but then they're given that advice not to, so they can't actually use the parental instinct. So there's such overwhelm. So I think actually, it's not even about our parents. It's about even just the last 10 years.
Yeah, and the information's gone crazy, or what information there is online, social media, and everywhere else. There's opinions from everywhere, every angle. It's very confusing for parents to know what the right answer is for different things, and they can get stuck going down different pathways. It's overwhelming. So it's one reason I like to advocate. As a health professional, I feel responsible that I have to give good evidence-based messages on what might help and which the next best step would be for different things. So that's why I like to speak up. The other thing that we're seeing a lot of is more, it's like, I don't like this term helicopter parenting, because I don't actually think any parent means to be like that. It's just maybe more of a less risk-taking. And I now see that actually I understand why parents might be averse to risks. In the world that we live in, then there are risks around. You know, there are challenges that it makes it very hard to let your child go out at night for a bike ride and that kind of thing. So of course we're going to be risk averse, but also that's leading maybe to more protective stuff going on, where we don't actually let our kids explore the world as much as we used to, and that then leads to less accidents, less problems, all that stuff. So
and that's the thing, you don't ever, you know, whenever I talk about this, I'm never ever making a parent, wanting a parent to feel guilty or anything. You know, the thing of it is, you're exactly right with that too, is that we want nothing more than protect our children. So whatever it wants to be labelled is, I can see it. I can see it in the last even 5 to 6 years, because I've still been in the school ground or kids going to school, and parents have changed. Parents have changed. They've changed from, you know, even like I said, you know, 15 years ago, what they, you know, the organic things and the non-plastics, and I'm not saying not to do that, but they're so hyper vigilant about everything. You would feel that the children would be feeling that, rather than just letting the kids just play and do those things that might be a little risky. We just don't do that.
Yeah, so across everyone, I think we've become more hyper aware and anxious and on edge, and that sort of, I think that like the anxiety threshold's just gone up a bit, and we're all a bit more fast, and we struggle a little bit to calm down again. So that affects everything, their sleep and their nutrition and their friends and all their learning. So this is why it's so important to detect this anxiety, but for us to slow down and teach our kids to slow down and model what that's like in when we have them at home.
Yeah, exactly. And that's the thing with I know I keep talking about conscious parenting, but not a lot of people know about it, but really it is just being aware. You know, I was a stay-at-home mum for 10 years, and I was a very, you know, loving, supportive mum, but I had a lot of stresses. So I look at things that I did back then, and again, I did the best I could, but I didn't regulate myself sometimes in regards to stress. You know, I was quite a stressed person. And over these years, I now understand that we have to co-regulate the situation, and that we can do that a lot of the time, and it's not, again, fault of parents, but it is also trying to slow down, regulate yourself to be able to help your child through those stressful times. Because stress and anger and all those things are actually a valid emotion, but again, as parents, we want to fix it. We want to fix it all the time. Like, they're not allowed to be angry, they're not allowed to do that, they're, you know, and so again, being hyper vigilant on kids' normal emotions, just to try and, you know.
Yeah, well, we don't have to be perfect as adults, and we probably shouldn't try to be perfect. We have to demonstrate sort of like when we're having a hard time, you know, we're still going to be reactive and a bit on edge and a bit tired and flustered. That's normal for us to have that. When we get home from work, we're going to be tired. We're going to probably say things we didn't mean to, and, you know, react more to our kids. And I think that's just the real like lesson in that, is to come back when things have settled and to talk to our kids. And often it's on the way to school or at night when they're lying in bed. This is the most sort of calmest point and non-threatening. You're not face to face, and it's really nice to say, this was a tough day for me too, and I'm having a hard time, and I'm really sorry that I said that. And this is how kids learn about emotions and what sort of some social behaviors that might be useful around different emotions. So yeah, no parent is perfect, and I don't think anyone should try. So it's completely understandable. Yeah.
Oh, absolutely. And also that it's human for us to be angry, and human for us to be frustrated. Like, it's normal. Again, you can't be perfect. So in regards to, you know, if you've got a young child, that obviously got all different scales, and this is like a big broad overview, but you've got obviously children that are a little bit more worried than others and things like that. You know, that's again a normal thing. When would you feel it would get to a point where maybe they'd come and have a chat with you if they started to feel that the worries were getting a little bit more affecting their lives, I suppose, than
Mm.
what would
Well,
be some symptoms, I suppose?
I've been writing courses for this platform called Emerging Minds, and I'm
Right.
just going to plug this platform because it's really good for parents who are seeking some idea around what is
Amazing.
normal anxiety and
Yep.
what is anxiety that might need treatment,
Awesome.
and then also the um, people who sort of might see the kids, like educators, health professionals, that sort of like education for all those sectors. But this platform, we've been saying that anxiety that is persistent, so like it persists. Now, the diagnostic manual psychiatry says 2 weeks or more, but I think in kids, like you can generally tell over a term or a few months when an anxiety is persistent, it's interfering with their life.
Yeah.
And when it's pervasive, so it like really stops them doing things that they love, they might.
Not what, like, I mean, they don't want to
Mm,
go to school anyway, but really next level
mm,
not going.
yeah, so they struggle with activities that might be normal day-to-day activities, and they withdraw either from school, home, or they have troubles with, parts of their life that are really important normally.
Yeah.
So the persistent, pervasive, and the anxiety sort of like it's it doesn't settle, so it just continues and like evolves into maybe other things, and it becomes more difficult over that time frame. And it's good to intervene early. So I would never worry about a parent coming in the first few weeks of a concern about a child. If they know their children really well and they're worried about a problem, they need to come and talk about it. And if they don't get what they need from that first visit with the GP, go to another GP until they find someone that they can talk to, or talk to the teacher, or talk to a trusted person in their life, to try and find out if this is something they should get support for. But that's sort of problematic anxiety, and there's lots of examples for kids. Separation anxiety is the number one. But at kindy and pre-primary, kids are naturally anxious at drop off. That's normal anxiety. Nightmares in the year 1, year 2, sleepwalking, scared to go to sleep, that is very normal in those early primary years. So there's all these normal anxieties that we expect, and they will be persistent sometimes for a long time.
Yes.
Going to strangers, like going to sleepovers with grandparents, going out on school camp, they are normal things to be anxious about. But then there's things that are more severe and persistent, like maybe fear of flying, or getting to the point where the anxiety at drop off is so strong that the child's vomiting on the way to school, has tummy pains, has headaches, is worrying about it the day before. Then we're talking more about an anxiety that's a problem.
Sure. Yeah. Makes it nice and clear.
Mm.
Do you do telehealth or anything like that, or not? Are you all just
yeah, like the Medicare rules have really got strict, so we can only do telehealth once we've seen the patient once in person, and and then only then up to a year, and then it starts again. So they're sort of clamping down a little bit on telehealth, but we do find it useful, and parents like it when they want to talk more after the consultation about their difficulties without the child being present. So it's got a good role there.
Yeah, absolutely. Hard, isn't it? Because both of our kids have talked about this a lot, and it's their story to share, so I'm always careful. Pretty severe mental health and anxiety, and so been through it, lived experience. But the thing is you want to support them, but you also they're only children. So if they're there by themselves with a psychologist or the doctor, they might not be open to talk about it. So it's a good idea to have the separate ones. The other thing too, obviously, if people can't come to see you in Murdoch if they're not in Perth, and this is happening, I think, all over Australia, the waiting list for paediatricians is just like like particularly in Perth. I know the books are closed. I know our girl's paediatrician, his books are closed, and he's only seeing kids up to 12 months of age. So if you've got a child who's in pre-primary and sort of having other these symptoms, where would they go first? Would they go, because again, the other thing, I know how great you are with families and your passion for families, but what I'm also hearing from families is they haven't got that doctor that they've known for a long time, or really understanding of children's health. Like what what would you suggest families do?
Well, then they need to find that doctor, because they're definitely, there's GPs out there that would be good in this, and I talked to quite a few of them around Australia. Like, they are out there, but seeking them out through maybe searching your local area, looking at the GP's website, looking at their interests. And GPs who have a child health diploma tend to have a little bit more interest in dealing with parenting and children related issues. Some GPs also put if they've got kids, and that can be helpful because then they've got that experience as well. But it's a bit of luck as well, like finding that perfect person that you can click with and feel comfortable talking to. But I definitely would say the first point of call, if there's a concern, is your GP or your school teacher, because they are very important in understanding your child's challenges and how they're going day to day. So that can be another person. They can sometimes direct you to where other kids might have gone. And then from there, like finding the right little team for your support network. So that might be psychology, but in younger years, OT can be very good too. Yeah, and OTs have training in mental health now, so they often are interested in emotional regulation and naming emotions and doing mindfulness activities and things like that. So OTs can be more play-based and very useful in this early setting.
Oh, amazing. Yeah, that's good. And that's what it's all about, play-based stuff, isn't it? So just having the, again, I was someone that, and I always have been that person, if things aren't working, I'll try and find someone that works for our family to support them. And I think a lot of parents just get lost, like, you really need to do that. But
and just back from there, the BRAVE program, I always tell parents to do this. The BRAVE program, BRAVE, BRAVE program is one of the more reputable programs that's online and free, and has cognitive behavioral therapy for kids and parents, and is run by psychologists. So they written the program out of University of Queensland, and it's very evidence-based and good because it's a good starting point for families just wanting to try some strategies with their kids. And then the Smiling Mind app, I'm always like plugging that one because that's free as well, and Australian, and has kids programs like 3-minute mindfulness for kids, and good for that slowing down thing at the end of the day. And I think generally speaking, not forgetting the rest of your child's health, like their sleep. What is their sleep like?
That's right.
Their screen time. How much screen time is there? Their nutrition and their diet, and not necessarily like completely changing everything, but just little tiny bits here and there, that tweaks that can make a big difference. And slowing down, not necessarily having 5 things on every week, like at the end of the day after school, going to every single activity, but maybe going to one activity and slowing down the rest of the nights so that you all have time to unwind.
It's important, and it needs to go back to the basics. It's some people might not want to hear that, but it really is just going back to the basics. Like, like even though my kids are bigger, I had the conversation with them because they don't really want to talk with me, but I've always made a decision to, no matter how much I'm working, to be home. And the biggest thing is they don't actually need to speak to you or play with you all the time. It's just that you're in their space. So it's like, if you, I know a lot of mums can't do that, or parents can't do that, but just whenever they do come home, rather than, like you said, going to too many things, just actually come home and just be in the space, because kids don't want to be busy all the time.
And don't forget to be present. It's so hard because we're all addicted to phones, but turn your phone off, because you forget, you miss out on opportunities to engage. If you have your phone on, you have your screen on, it's so hard because we all have things we need to do and check and send and pay. There's no time in the rest of the day. So it is very challenging, but having dedicated time with the child where you just are present, even if you don't feel like you're doing much, is actually really powerful for your children.
Even just sitting in the lounge room, with them and not on the phone, like that's just in their space is really important. So I mean, again, we talk about this till the cows come home, but the other thing when you talk about sleep, of course, that's my passion, but that's what I'm finding with the older kiddos when they're having anxiety going to school, and giving parents the tools, is they need at least 15-20 minutes of just actually being in the room with them. And people don't think, oh, I do 5 minutes, I do 10, but that's that time that they actually start to really relax. And then we talk about your day, and then they go, well, Susie was really mean to me on the playground, and but if you're sort of getting through dinner and how was your day, it was all right, and then go to bed, then they start, their anxieties are worse when they're by themselves, and not debriefing with their parents. So that's a really big thing that I've found. And just quickly, just to add on to sort of anxiety too, is what's your thoughts again of the increase of neurodiverse children? So I know that, again, that's a really big umbrella, but let's just talk about ADD or ADHD. A lot of it's are much more talked about. My children have it. I've had it my whole life. I was diagnosed as an adult, but I've had it my whole life. But what's your, is it rising, or is it just that we're becoming more aware of, again, symptoms?
It's probably the most asked question I've had lately, because it's it's very topical and prevalent in media and everywhere else. And like you said before, there's a lack of really, like, pediatricians. They're not keeping up with the pace, and it's getting a bit challenging to get a diagnosis or to get support quickly. But there's many factors, and it's really a whole podcast episode, really, this whole thing. But
I know, I shouldn't have asked that, should I?
no, it's okay. But I was just going to say there's probably two things to say. One is anxiety and ADHD can sometimes completely overlap and be very difficult to figure out which one is which until you treat one. So potentially anxiety management is still relevant first as a way to work out if this distraction and difficulty learning and difficulty keeping up is actually related to anxiety, and is it something that settles with a bit of support. And that can be a very good way to start, because anxiety is the more common one. ADHD can also cause anxiety, so some people end up just by default just going down the ADHD path and treating that first, and the anxiety then settles a lot because they're much more calm and regulated and able to process information, so everything seems easier and less overwhelming. So that's the first thing. They're very overlapped, and we don't really know how much so until we treat one or treat both, and can't forget each one because they're both relevant. The second thing about the rise, it's not really a rise, because the current stats say we're still underdiagnosing ADHD, believe it or not. And we're still actually, no, but it's so crazy, because it's all, I feel like I'm seeing five a day, but there's meant to be 1 to 2 in every class, or 1 to 2, probably 1 in 10 to 2 in 10. Like, there's somewhere in there that there's these stats for the prevalence of ADHD. It's as common as diabetes, really. It's very common, but we're still not up to that with how much we're diagnosing ADHD. I think we're getting close, but the data, it's hard to, there's not much data out there, so we don't see. But yeah, that's the issue, is that we're still catching up with diagnosis, and there's been a huge sort of awareness through social media and all that kind of thing, with people wanting to get supported. So
the other thing with that too, sorry, just before we finish up, is you know, going through that path, you know, you can't get a proper diagnosis without being at a paediatrician or psychiatrist. So say again, a parent might be thinking, oh, you know, I really think my child is having all of not symptoms, but, you know, can't think of the word. What would you advise them to do step by step? Go to their GP, talk about it. Like, what can they do if they can't get into a paediatrician or psychiatrist?
Well, like, again, like, the GP would be a good point of call if they have a good GP who's willing to assess all the different factors around that child's development and learning, not just hone in on ADHD. ADHD is a really important condition to figure out, but got to think about all the contributing factors as well. And so that's one. I use the Psych Profiler quite a bit. The Psych Profiler is online and is, again, it's developing WA, this one. It's quite good at just pinpointing where the main concerns are. And parents, it's $5, and parents can answer a whole heap of questions. And then it gives you kind of a bit of a guidance as to, okay, the biggest thing at the moment is anxiety. Well, let's go down that path, show that to the GP, and it just basically gives them a bit of guidelines on where to go and what to do. But if they think it's ADHD, the parents think that, they usually are right. They just need to get the right help. And it will take a while, and be patient with that. It takes a while.
Yeah, and it's not like the diagnosis for our kids was huge. We had behavioural psychiatrists, but you know, it's not like you've got these symptoms and, oh yes, I think it's ADD. Even for me, my parents had to write things, and it's quite a big thing. But it is
mm,
talked about a lot more. And I think it's actually, as an ADD person and all the struggles that I've had, which I never talked about, I thank goodness for our children that they've got that their brains, they're amazing kids, but they are different the way that their brains, like I'm a really amazing human, but my brain thinks differently and works differently. And so if I was given those tools when I was younger, I wouldn't have suffered from, anxiety and depression as I did, I think. I don't know, maybe, I don't know.
It's a superpower. It's very, very important. Like the abilities of children with ADHD is incredible. They just need to be able to nurture that and find the best way to support them with that. Really intelligent and bright and creative as well. So yeah, shouldn't hold them back. Yeah,
exactly. And that's why I want to talk about it all the time and share as much lived experience, because I have parents reach out when I've talked about it and they're fearful. I'm like, don't be. Like, it's, if you can harness it and understand it, it's absolutely a superpower. We're unique.
The other way that they could get an understanding is to read and listen to podcasts and all that kind of thing. But the book, the ADHD Go-To Guide, I have that here. Like that's written by a paediatrician that I've been working with here in Perth, and it's a really neatly written book, really easy to understand. So in the lag time that you're waiting, you could read and educate around these things, and you might then start to see yourself or your child in what you're hearing and reading, so that you get more understanding. Yeah,
that's fantastic. Well, thank you so much for your time, because I know how busy you are helping
people
in lives.
That's good.
The last, just before we go, Emerging Minds is that a platform or a program? Like, where can
just a website online? Yeah, just Emerging Minds, and lots on there, lots of content, lots around mental health, parenting support, webinars and workshops, all sorts of things. It's all free, so I'd definitely recommend it.
I'll tag all of this in the notes. So thank you so much for your time today and all of your advice, and hopefully we can help some people out.
Thanks, Donna. Thanks for having me.
Have a great day. Thank you so much. Good to see you again.
Yeah, see you, Donna.
Bye. See you.
Bye.